You use focused auditory input in combination with production practice so that you're building up the perceptual system as well as the production. So you make sure the children are perceiving it. And that comes out of research, both of Hodson and Payton, but even older research on motor speech production that showed if a child produces sounds incorrectly all the time, what will happen is that they will not perceive them accurately when they don't produce them correctly. So the use of this auditory input in Hodson's approach has been a very dramatic and very cohesive way of bringing in everything we understand about both auditory processing and phonology. And Hodson strongly emphasizes that all three of these components are essential aspects of her intervention approach. The next point is the value of timely reinforcement. I talked about that earlier. And there's a nice article on it for EdTech, The Behaviorist Goes to School, leveraging behavioral economics to improve educational performance by Levitt, List, Neckerman, and Sadoff, that was published in January of 2016. But what these authors say is there's a substantial impact on outcome when rewards are delivered immediately. When a child knows when they do something that they got it right or they got it wrong within a few milliseconds of them giving that response, that's terrific. And you should, when you're purchasing software, ask the technology developers and the salespeople, does it provide immediate reinforcement for every single response that the child makes? And what I want you to see just from this picture, and when you go in and click on the link, it's so much fun to see the whole brain light up. But what you see is that the human brain is a language brain. That human brains, as far as the brain is concerned, language is everywhere. And so semantic concepts for motion are related to the parts of the brain that we use to move. And semantic concepts related to size are in the parietal lobe, registered for in the part of the brain where we have body concepts. So the brain is, or the human brain is a language brain. And I say that because a lot of my colleagues who still really follow linguistic approaches, and that's a fine thing to do in the importance of linguistics, are right that the human brain is a language brain, and language is very important in the human brain. And I have a colleague, Katie Godfrey, that really has done some outstanding work in helping teachers understand that and helping children of poverty with building this language basis that really creates a brain that's a problem-solving brain and a thinking brain. So the advent of introducing neuroscience doesn't in any way negate the contributions of linguistics. It adds to it. And the Gallant Labs is a good example of that. Do not all pre-readers who are at risk based on these brain level differences or genetic differences end up with reading problems. And what they looked for was protective factors, and I've kind of circled for you that one of the biggest is oral language skills, speech-language pathologists. So here we come full circle again to the importance of language in reading, that if children have really good language skills, then that acts as a protective factor to keep them perhaps from experiencing the marked reading problems that other children might with the same brain level differences or same perceptual differences. The good news is the one thing we know is intervention with these children helps. The brain is an experience-dependent organ. These are children who have neurodevelopmental problems, and providing them with positive experiences works. So even in situations where ASD and other learning problems aren't preventable, because the disorders affect connectivity, in many cases, speech, language, and social interventions drive white matter development, and they facilitate homeostasis of inhibitory and excitatory mismatch. So the treatments must be individualized to the child's specific problems because ASD is so heterogeneous. The key is not looking for a best treatment. The key is sitting down with every single child that you have that's on the spectrum and figuring out what works for them, what benefits them, what doesn't.